I will have the buffalo Cushing syndrome kind of feature. So type C. Type D is delayed. So what happened? A mother took a drug during pregnancy, but she can see the outcome after 9 months. So teratogenic effects, or I'm taking a drug today, I'm exposed to a X-ray today, and I develop cancer after a while. This is delayed kind of adverse effect. E is end of effect. I stop the medication, after that I will get some adverse effect. So kindly try to remember this concept. So mechanism of drug action and drug adverse effect also going to help you very significantly.
Yes, doctor.
Okay. Now my question, if I give you drug A and drug B together, what can happen? Jana is there?
Drug interaction.
Very good. It will be introduced with the drug interaction. So drug interaction, I think you know now what is additive effect, what is potentiation, then what is summation, you already know. Please try to read the definition, examples, and memorize it. And for any clinical year student, it is very important to know list of enzyme inducer and enzyme inhibitor. So I'm clear up with the drug interaction area. So most focus on listed drug given to you. What are the drugs are enzyme inducer? What are the drugs are enzyme inhibitors? And also consequences. What are the one event will come? It may be synergism, it may be additive effect, it may be potentiation, but at least one effect will come. Okay. Okay, this time, I think all of you remember loading dose and maintenance dose, right?
Yes, doctor.
Okay. This time, actually, you will get the formula, but you have to really find out what is what, and you just put the correct information there. Because if I don't give you the formula, it will be very tough for all of you because to me now important is understanding why we need steady state concentration. Once we achieve steady state concentration, we're going to maintain it, right? So loading dose, maintenance dose concept is already there, and you'll get one mathematics from these two formula, and already formula will be given there. So you have to really pick out, or if need little bit of modification of the, if milligram and a gram, you have to convert to milligram, etogen. Other things already been given there.
So doctor, it can be given as the answer, and we have to identify whether it is a loading or a maintenance dose.
Even with the question scenario, after reading that, you should understand this is talking about the loading dose or maintenance dose. And another clue, if you bit confused with the question, always go to the last statement. Always go to the last statement. If I ask you to which concentration of the drug you should give in every 10 hours, 15 hours, so maybe that should be the maintenance. Yeah, so you refer to the last statement of the question. So that is really what we are looking for. Okay. And there was some formula, right? So dosing, that chapter you have to read really very nicely. Your clearance value, loading dose, maintenance dose. You have to really calculate a dose for small children. Okay.
All right, doctor.
I think the half-life concept been taught by Dr. Azli or me?
You, doctor.
So what is your achievement actually? What is half-life?
the amount of time required for the drug to reach half its concentration.
So what information you are getting from half-life? What clue it gonna give you about a drug?
Duration of action.
Very good, duration of action. So I think many students, even after becoming a doctor also, they're not really sure why they need half-life. Like therapeutic index, why you need therapy? In one word, you'll be telling me why you need therapeutic index.
To know the side effects or the toxicity.
Question instruction is only one word.
Toxicity.
Any other opinion?
Margin of safety.
Very good. Why we are in the medicine, right? We are studying about the drug. Our concern is safety. If not safe, then straight away we really cannot say toxicity, because in human nobody will allow you to bring toxicity. We can say adverse effect. Okay? Toxic means is already confirmed. 100 dose going to produce adverse effect on 100 people. But for drug, it's not like that. Not all patients having the same kind of discomfort with a drug. So toxicity,
okay, doctor.
Yeah, toxicity is not the correct thing we do with therapeutic index. How can I know one drug is safe or unsafe? Do you have any tools for that?
What, doctor?
How can we say one drug is safe, one drug is having adverse effect? How can we tell that?
By therapeutic index.
Very good, by therapeutic index. So please remember.
Higher the safer. The higher the therapeutic index, the safer is the drug.
Okay, remember, I think while I was teaching, it was, I said safety margin is more than 1 is safe, right? If the toxic dose and therapeutic dose calculation, because therapeutic index is the proportion between the toxic dose of a drug divided by the therapeutic dose of a drug. If this calculation is more than 1, drug is already safe. Somewhere you might can see, they can say it's more than 100. So I think try to adjust. The main concept should be 1, right? And if you read the book, you'll find it is 1. So that the part, okay. How many area we cover? Pharmacokinetics, some part of the pharmacodynamics, drug interactions, right?
And a bit of toxicometrics.
Yeah. Okay. Let's go to antibiotics. Okay, are you there?
Yeah.
Okay, so antibiotic, I think general chapter is very important. What do you mean by MIC, MBC, bacteriostatic drug, bactericidal drug, and very important nowadays. So very seldom people make mistake where they should give antibiotic, where they should not. I think I already given a very precise idea. If I ask you, what are the justification you have while you are giving a antibiotic? How many things you're going to monitor the patient? Who can get what I'm asking for?
The signs, symptoms, and the site.
Sorry?
The signs, the symptoms, and the site.
Not really. You got the thing I'm looking for. I said, what are the rules you should follow actually while and you have to explain those rules to your patient. Many times I remember, I think I'm very sure if you go to clinic, doctors are giving you antibiotic, they will tell you, please, 2 times in a day, you have to continue for 5 days, 3 days, or 7 days, right?
Is it finished the prescription of the antibiotic?
Yes, so they keep the emphasis on that. So I think I also try to cover and try to teach you some of the discipline while you are prescribing antibiotic for your patient. Anybody has idea about that? So, okay, let's go back to the general discussion about the antibiotic. It's very, very important. It will contribute, I think, again, more than 10 marks. So general chapter or introduction to antibiotic is very important. So from there, you have to really understand what I try to mean about chemoprophylaxis, empirical therapy, what are the general guideline or discipline you should follow for antimicrobial therapy, and what are the things you should consider before you prescribe an antibiotic to anybody. Okay?
Okay, doctor.
Okay, when you are reading beta-lactam, you should follow the sequences been given into the slide. So classification of beta-lactam antibiotic, mechanism of action of beta-lactam antibiotic. Okay. Okay.
Doctor.
Yeah.
For the antibiotics, do we need for beta-lactams, do we need to know all the generations of cephalosporin?
At least two examples from each generation.
Oh, all right.
If I ask you from the whole beta-lactam concept, I got a patient who got gram-negative bacterial infection. It can be any gram-negative bacterial infection. From whole of your collections of drug in beta-lactam, what will be your drug of choice for gram-negative infection?
Third generation for cephalosporin.
Everybody agree with him?
Yeah.
If I ask you, so this is called concept. This is the summary you should come up after your study. I think I also try to give this kind of message to you. Nobody will remember all slides, but when situation come, people will be asking you, what will be the drug of choice or personal best selection drug for a certain kind of infection? So if I go to gram-positive infection, what will be your drug of choice?
First generation cephalosporin or penicillin?
Yes, if applicable, we'll go for long-acting penicillin, right? Because still so many government hospitals all over the world, still they're using penicillin because it's cheaper. In case the patient develop resistance with the penicillin, then we can go for cephalosporin first generation. So general chapter also got discussion about the development of resistance. The 5 fundamental steps, all are important. At least 2 steps, 2 questions you will get from how resistance been developed. It may be enzymatic inactivation, it may be alteration of the binding site, it may be bacteria producing alternate metabolic product, so there are 5 steps are involved, so maybe 2 at least you have to recall during the exam. So have I done with the introduction to antibiotic and beta-lactam?
Yes, sir.
So altogether, introduction and beta-lactam will give you approximately 5 questions coverage. And remember, I personally like very much other beta-lactam like meropenem and aztreonam. So if I ask you, what is the role of meropenem? I think I shared the story of Mission Impossible 2 at that time, right? Why people remember meropenem?
Broad spectrum antibiotic.
Broadest spectrum. It has equal activity with the gram-positive and gram-negative, right?
Yes.
Also, I said the kind of adverse effect they have, no other antibiotic having the adverse effect like that. very few antibiotic you'll be getting in life who can cause adverse effect like meropenem. Okay, so other beta-lactam also to me is very, very important, because when you guys going to start your husband, I wonder many of the mainstream drug, it no more will be usable. So who knows, maybe you can see a lot of cases, a lot of septicemia, critical patients, you might need to use other beta-lactams like meropenem or aztreonam. But you have to have the concept when you should touch meropenem, when you should touch aztreonam. That is very important. So I think antifungal been already been very, focused actually only on 3 drugs, right? Amphotericin B and also fluconazole, and that's all. So I think before exam you should just focus on fluconazoles and amphotericin B, mostly mechanism of action and clinical uses. Paham tak?
Yes, Doctor.
Okay, I think antiviral, although I have given you the whole slide, again, there was some limitation, right? We just cover herpes simplex virus, varicella zoster virus, hepatitis B and HIV, right?
Yes.
I think you have to add one more topic is influenza, because this corona time, there are so many anti-influenza drugs actually using in the trial for corona. And I've been also instructed to use this drug. Yeah. So you just add up with that. Other than that, you just focus on mostly mechanism of action. All drugs, mostly mechanism of action and classification. So what will be our area of focus for antifungal?
The amphotericin B and fluconazole.
Yeah, mostly mechanism, classification. It will be cukup to memorize. And antiviral also I already mentioned. So if you study antiviral, antifungal drugs, it's going to contribute again 5 to 6 SPQ for you. The biggest challenge will be for you at this moment actually is the antiprotozoal drug. This will be the biggest challenge. So antiprotozoal drug, I think the main focus should be on albendazole, mebendazole. Why?
Mebendazole has a very broad spectrum of activity.
Yes. So I think there was few drugs been discussed, but focus on mebendazole, albendazole, and parental pamox. Mostly their mechanism of action. And one more drug is metronidazole. Again, I think here everywhere most is you have to focus mechanism of action. So I think 3 to 4 drugs, mostly you have to focus on mechanism of action. That is the tips for here. Anti-cancer drug, I think you guys already know. I want the bigger picture. If I say cell cycle arresting drug, so it's going to be arrest any of the phase in cell cycle involved. If I say genotoxic drug, you should be able to understand what I mean really by genotoxic drug. And you'll find one specific slide that telling drug specific adverse effect. Okay, like if I say methotrexate, it has some specific adverse effect. So that table will be very, very crucial for you. And please don't forget, I did mention about steroid prednisolone at this moment, at this your situation. Can you tell me one drug who can inhibit your immunity? Immunosuppressant. So for what drug you know?
Steroid.
Steroid.
Friends.
Why you want to suppress somebody's immunity? Is it good for body?
For organ transplants?
Mostly it is for organ transplantation or some of the
Autoimmune disease.
autoimmune diseases where your immunity been triggered. Panta. 1 second. You know our student Rahaf? Wait. One student couldn't attend the class. Sorry, skip. I think I already add you. Can you check? Okay. Where I was?
Steroid. Autoimmune.
Yeah. So I try to arrange in such a way you study at that time and you got a more detailed picture in endocrine system about the steroid. I think that knowledge is not going to just thrown away. There are a few others, but at this moment, you only familiar with the steroids. Let's go to drug development and discovery. Okay, so there was phase 1, phase 2, phase 3, and phase 4. Why? There are few reasons why we need phase 1. What is the main discussion in phase 2, phase 3, and phase 4? So that will be very, very important. For drug development, straight in one day, like you see now with corona drug trial, nobody couldn't go directly for human trial of the drug. They used to check the drug with the animal first, right? After that, they go to human body. So I think this transition phase you have to understand quite clearly. Okay. So I think so far that's all as BQ from my part. Do you have any question regarding SBQ so far?
Doctor, for the antiprotozoal drug, there were 4, right? Can you repeat the? I heard the albendazole.
Mebendazole, irantel pamotes, and there will be one anti-malarial drug, mostly on prophylaxis.
Okay, thank you, Doctor.
Okay. It is very, very difficult to fail in pharmaco unless you don't want to write, you sleep in the class. Yeah, then only possible. I think after this, it's not so easy to really not to pass in Mako. SAQ, you should develop, the understanding the importance of the topic. So, for example, if I go for autonomic nervous system, anybody want to set question in the world, definitely they'll be thinking of either cholinergic poisoning or atropine poisoning, okay, for cholinomymetic. Sympathomimetic drug, mostly, classification of sympathomimetic drug, pharmacological effect producing by them. But eventually, the whole autonomic nervous system you are reading only to understand why people develop hypertension. So developing hypertension, is it sympathetic or parasympathetic action?
Sympathetic.
Sympathetic.
Yeah, and to reduce hypertension, you have two choices, alpha blocker or beta blocker, right?
Yes.
So what I try to say, today's world, hypertension is one of the very highly incidental diseases in the world, right?
Yes.
Okay. So I think these are the clue you should understand, because no choice. The chapter arrangement is like that. If you study autonomic, naturally it should come either cholinergic poisoning and its management, either atropine poisoning and its management, and mechanism of action of acetylcholine, noradrenaline, one set. Anybody in the world, they want to set a question, this can be mindset they should have. And another one, what is the overall outcome of the chapter? So the whole chapter, they try to tell sympathetic, going to increase your blood pressure, parasympathetic, along with many other functions, they will decrease your blood pressure, right?
Yes.
And how alpha blocker and beta blocker can be used as an antihypertensive drug in details. And do you have any case study on this?
We had a few assignments on this.
Yeah. I give you another lifelong tips in CSMS. If you have any PBL, it is a must SAQ. If you have a case study, it is always going to be a consideration for SAQ. Panta. So you've gone through endocrine exam, right?
Yes.
Doctor.
Did you get any question from PBL for SAQ?
Yes.
Yes.
Until KMOT, there will be no change in CSMS of that rule. 1 second. Yes, boss. Hello. Hello. Yeah. So I think you should consider these 3 to 4 topics for one SAQ should be. So don't miss any case study you face. And we don't have any PBL here from next block onward, or it may be started with the endocrine units. Mid-course is only anatomy and physiology. So you read everything at the time. Yeah. So any question? Otherwise, today I am super busy. 11 o'clock, I have a meeting in office. I have to go there.
Doctor, During the exam, will we get both the links at the same time, or is it gonna be separated?
This is Dr. Azli is the coordinator. I think you guys can share the challenges you had and you explain them. And you may can tell them we need the option of flipping to question 1, SAQ1, SAQ2 and SAQ3 simultaneously, because some of us maybe we finish SAQ1 a bit early. So I don't know, what are the challenges you face? Maybe you can share. And you may can ask him, once he send you the link, he should voice it out. Otherwise, you're focused on writing, and most of the time you are not sure when lecturer pass the link for, silently. No need to be silent, or maybe I can call and tell him. Do you have any specific suggestion so that I can tell to him, or you guys also can tell him? You already sit for 3 online exams. So what are the challenges you face and what we shouldn't do?
Sir, typing
what you
speed.
said, Doctor.
One by one.
Like what you said, Doctor. To give both links at the same time, because we had trouble getting one link at one time, and then the doctor should tell when they sent the link. Because yesterday we didn't know, and some of us knew about it like 2-3 minutes afterwards, after the link was sent. So for me, I think
And doctor, one of the most important is the typing speed, means the duration given for SAQ. It's a bit less when it comes to typing.
Normally, average one adult should able to type 15 words per minute. If you see, and normally if you don't have much practice with that, may be difficult, but average 15-20 anybody can do if you can remember the keyboard. You remember the keyboard?
Not exactly, 90% remember, but the speed is very slow in my case.
Then you have to stop playing PUBG and you have to practice some more with the typing. How good you are in PUBG?
I don't play PUBG.
Oh, you okay? Good boy. So maybe you can just write in the group. You can give your suggestions. So these are the things we facing, because I think lecturers also not familiar with the style before. So it's a new case. We are learning newly. And unless you're not mentioning the problem, nobody will correct the problem.
Doctor.
Yeah.
There was one issue where students, when they actually finished their exam paper, when they click submit, the exam form wouldn't actually submit. It'll be like loading and loading.
To me, actually, technology never can replace human, and especially in education system. If so, artificial intelligence could have do many things. Even your plane is flying autopilot. Nowadays, your all car coming also with the autopilot. But teaching is something you really need human touch. Saying so, I think lecturer, we also, and internet is the issue. You have to really be prepared with the data. First, the loading problem is mostly because of your internet connection. And I think, is it lecturer they specified what should be your minimum internet speed to perform these activities?
No.
It should be minimum 2 megabyte actually, download speed you should have for uploading purpose. So if you try to, how many of you try to sit exam with the mobile phone? Is it problem happen when you try to sit exam with the mobile phone? No answer?
What, doctor? Sit the exam with the mobile phone?
Mobile phone. because any laptop should be able to upload. Otherwise, if you make it with the hotspot, connect with your phone, so there will be some interruption in between. But if it is a Wi-Fi connection and you are using your laptop, it's very unlikely with Malaysian speed. Very unlikely. So these are the few things to check first. Only challenge in these online classes, there are a few, but the most important challenge is the data speed. Okay, so I have a meeting at 11 o'clock, so maybe another 1 or 2 questions I'll take. After that, I have to get ready for office.
Doctor, just one more issue about the online exams, right? The last online exam, the lecturer did send the link at the correct time. It's just that the platform, which is this Google, the Microsoft Teams, it delays the message to some people. So they can't click the link at the same time when the lecturer sends the link.
Is it happen with other exam or only one exam you get this kind of experience?
Other exams too.
Happened with endocrine, the last set, and pathology.
So I think the solution is then lecturer has to be a little bit flexible on submission time, because nobody want to, and I think we should have the belief and respect for the student as well. And you guys are not responsible for this situation. So blindly giving blame of anything, I'm really against of that. And we have to think what we can get best of the situation. And I'm sending you question and taking online. Unless otherwise you are a prophet from Allah and you will not search Google and your slide, I'm the fool, not you. Simple. This is exam, you're going to be judged, grade matters and all that. And I think some point of time faculty was telling it's an open book exam, right? Correct or not?
The what, doctor?
It was been mentioned as the open book exam, right?
For the midterm for Famaku.
I think they are also not sure about the instruction, because I heard that word repeatedly. Mid-course is an open book exam. I don't know what is the ministry guideline telling. You cannot see your booklets, your slides.
Yeah, for the previous exam. Yeah, it's in the sheet.
What they said, you cannot see.
You are not allowed to have any notes, books, or slides in your exam. That's the exact instruction written.
How many of real life follow this? And how can I say you guys, do I have any way of proving that? Is it possible?
No, doctor.
Technically, no. Are we 100% confident the way we taught it was sufficient enough for the students? So it's okay. These are sensitive issue, better not to discuss. Just try to comply with the instruction as much as possible. But I really don't know in real life how much it is possible. You have an exam, you have an option to open your book, and you are not going to open the book. I don't know. Okay. So is it okay I finish the class now?
Yeah, I think.
Yes, doctor.
I think until exam, if you have any difficulties, you just